2, 1.
Brilliant. Just get the presentation up, make sure everyone can see it. Just briefly introduce myself while we are waiting for the presentation up. My name is Rebecca Dunstall. I am clinical specialist at Careflex. I'm a physiotherapist by background, and when I graduated many years ago now, I was fortunate that I specialised straight away into learning disabilities and neurology. So postural management has really been a key objective of mine with my clients throughout my clinical career. I hope everyone can see the presentation now. I don't think we've got anything in the chat. Everyone can see it?
No, we are fine.
Okay. So first of all, just to quickly run through what we actually mean by postural care. It's the holistic use of any technique that minimises postural abnormality whilst enhancing function. It does have to be a multidisciplinary approach. I believe, Les, we've got a range of different people in the audience today joining us.
I believe so. I believe there's some physios, some OTs, some care home managers and care home staff. Yes.
Brilliant, excellent. So as I said, it does work better as a multidisciplinary approach, and we need to respect all activities and interventions that might impact on the individual's daily life, and specifically their posture and function. And it must be considered on an individual basis following a comprehensive postural assessment and then the subsequent goal planning. Now, posture is directly related to an individual's health and well-being, and if an individual has postural challenges, potentially due to injury, then a postural management programme could be a regular change of position throughout the day and night is key. Now, this session, I know we are focusing on seated posture, but we always advocate a review of an individual's posture throughout the full 24 hours. It is believed that postural challenges begin in lying and then compound. Sorry, we're just getting a bit of echo from people's mics. Could people just make sure their mics are off? Sorry, it's just we're getting a bit of echo. Brilliant. Okay, so as I said, we are focusing on seated posture today, but we really do advocate this use of regular change of position throughout the full 24 hours. And I always believe that many postural challenges begin in lying and are then compounded in sitting. So, for example, if an individual is sleeping in side lying, maybe in a fetal position for 12 hours straight at night, how can we then expect them to sit out and extend out successfully during the day? Some people, as part of the 24-hour posture management programme, may need therapeutic positioning and the use of equipment. And of course, we'll be talking about specialist seating today. Interventions should always be regularly reviewed to ensure that they do continue to meet the individual's need, and then this will form part of their care plan. So let's bring the focus back to sitting posture then. What do we actually mean by good sitting posture? So the body will be conformed to the supporting surface as symmetrically as possible. Now, obviously, these are gold standard, and I do appreciate we work with a range of different individuals with a range of different complexities in the postural presentation, and this would be the gold standard, what we are aiming to achieve. The body weight distributed equally over the maximum surface area, a balanced and stabilised body that can still adjust to change, such as demands from different activities of daily living. The body segments are supported and aligned as much as possible. And then the upper limbs are free from their load-bearing role to enable functional movement. Essentially, once we achieve this good sitting posture, I'm using inverted commas here, we are wanting to facilitate effective functional performance. We want the individual to maintain this posture without becoming fatigued, but we also want to protect the body systems and reduce the risk of secondary complications. So that's it in the simplest of terms. Specialist seating can help toward these objectives by preserving or even restoring body shape, and this will be through correction or accommodation of posture. therefore reducing the risk of further postural deterioration and other secondary complications, such as contractures and deformities and pressure injuries and so on. Specialist seating can encourage the body segments to work efficiently together. It can promote pelvic stability and postural control, which will then help towards functional movement by releasing the upper limbs from that low bearing role. Specialist seating can encourage body symmetry and alignment through the trunk, head and limbs, and especially the feet. It can facilitate normal or even control abnormal movement patterns, especially things like high muscle tone. It can provide a stable base of support to promote function, but also promote good health and well-being by protecting the soft structures and internal organs too. Just as a visual cue to what specialist seating can achieve, we're aiming for this optimal sitting position, and again I emphasise that this would be the gold standard and might not necessarily be what we can achieve, but what we are aiming to achieve with our clients. And essentially we're trying to get the body segments to work efficiently together, where the body is upright and stable as possible, positioned as symmetrically as possible. We mentioned about the body weight being distributed equally throughout the chair over the maximum support surface. So essentially the back of the body will be in full contact with the chair. The head and neck and limbs in midline, the pelvis stable and supported at the back of the chair, and the feet fully supported. I just wanted to quickly recap on posture. It is a very complex system. It's highly flexible, but that does mean that it is at risk to postural damage because it is so flexible. But to reduce this very complex system into manageable proportions, you'll mention us talk about body segments quite a lot. We're reducing it down to these system of segments and linkages. Now, posture is the way that we hold ourselves or position these body segments in relation to one another, but also their orientation in space. Now, clinically, we'll obviously ensure that the postural management programme targets all these body segments. But the purpose of today's session is to just emphasise that postural care has to go deeper and wider than just these clinical body segments. And this is then where we bring in this holistic approach and what we're going to be focusing on. Now, it's essential that we meet our clinical objectives, of course, which will be based on our assessment findings, our SMART goals, clinical reasoning and the outcome measures that we use. But we will not achieve these if we don't apply a holistic approach to specialist seating provision. By holistic approach, we are addressing the client, of course, but also their support network, as we often rely on them to implement specialist equipment and to be compliant and consistent with the use of this equipment if the client needs support to do that. But also the cost effectiveness. So we'll cover those two a bit later on, but we'll focus on the client first of all. But first of all, what do we actually mean by holistic? Now, the Oxford Dictionary defines it in relation to medicine anyway, as the treatment of the whole person, taking into account mental and social factors rather than just the symptoms of a disease. So essentially how the individual is presenting rather than focusing just on their diagnosis. Now, it's essential though that we apply a holistic approach because it ensures person-centred care, not a narrow focus on the diagnosis, as we've said, but also a consideration of the person's well-being. Now, the aim is to understand daily life for our clients and how the chair will fit into it to ultimately ensure compliance and consistent use. As a result, health and social care professionals then can expect better engagement from our clients as they feel involved in their own care, and this in turn will lead to better outcomes and hopefully us meeting our clinical objectives. Now, the big thing we want to cover, especially when we think about holistic care, is the expectations from our clients. What are their individual goals? What do they expect from specialist seating? What is daily life like for them, and how will the chair fit into daily life? How can we best prepare for the seating assessment? So maybe showing them things like photos or videos beforehand will help them come around to the idea of maybe needing more specialist equipment, because sometimes they can be quite medical in nature and we want to try and ease them into that transition. But also, how can we encourage engagement with the prescription, which will essentially be the care plan? And this obviously these answers are going to be totally individualised to the client, but it is worth covering these aspects just to make sure that we are setting off on the right foot to get maximum engagement with equipment. So the client then. Now comfort at CareFlex is our main objective, and it's usually our client's main objective too, as comfort is key for quality of life. Lack of postural care, maybe where an individual adopts prolonged or abnormal postures, can cause tension on the body and increase the risk of significant pain. Being comfortable and feeling safe can increase tolerance of desired sit-in position and compliance with equipment. So I keep bringing it back to that consistent use and compliance. If an individual isn't comfortable, then they simply may not use the chair regardless of the clinical benefits. I wanted to do it, it's quite difficult. We usually do these training events where we're in person with people and we do these activities. So I just want to be mindful. I don't want to cause anyone any pain or any problems doing these activities. But if you are able to join in with them, then I just want to really emphasize the importance of comfort. And if we put ourselves into our client's shoes and maybe adopt, and I'm going to make Les and Alex do the activity as well.
I feel the need for a disclaimer.
So again, please be mindful, don't cause yourself any problems or fall off your chairs. But if you imagine adopting an asymmetrical sitting position, so we've got a pelvic obliquity where one side of the pelvis is higher than the other. We've got a scoliosis at the spine, so we lean in maybe to one side. And we're also wind sweeping, so we've got the legs wind sweeping and the knees sweeping over. I'm going to make you sit like this for the entire session.
You can try.
I don't think I come out of that position. I mean, if you gave that a go, do you think you could maintain that for the next 45 minutes, maybe the next hour, the next 3 hours, the next 8 hours? And this is why we need to make sure that we are emphasising comfort for our clients, because they are simply not going to use that piece of equipment if that's the forced posture that they're going to be sat in for that length of time. Next, we have energy management. So fatigue can affect all aspects of our client's life. An unsupported posture causes fatigue by making inefficient use of the body structure. So the muscles tend to tire more quickly because they have to work harder, which then of course results in greater energy consumption. Gravitational forces can also make sitting effortful if we work with clients who maybe present with muscle weakness or abnormal muscle tone. Fatigue itself can be associated with significant postural challenges. So we might see things like scoliosis with lateral flexion at the trunk, increased thoracic kyphosis, contractures, and even pelvic instability in those who are becoming fatigued within the chair. It can significantly restrict a person's ability to engage in daily living, as well as having a negative impact psychologically and socially. So by implementing fatigue management strategies, and we can do that with specialist seating into daily life, it could reduce the impact and the probability of fatigue becoming chronic for them. And energy conservation will make it easier for them to live a more meaningful life. And again, it comes back to, I keep pressing on about this, but it's about our clients being compliant and consistent with equipment, and that's the only way we're going to achieve our clinical objectives. Independence is also crucial for our individual's well-being because it's an important factor in living a fulfilling life. Functional movement can also protect the body structure and reduce the risk of injury. Now, when it comes to good sitting posture, it's stability, or pelvic stability especially, that's key for encouraging this normal functional movement. So the upper limbs will become free for movement through effective stabilisation of the pelvis and trunk. And when we run through the case study shortly, we get a bit more of an idea of how actually that impacts our clients. Now, specialist seating, thinking holistically, it must enable our clients to be able to engage in activities of daily living and the hobbies that are important to them. Otherwise, they'll refuse to use the chair, and rightly so. So I've got another activity. Again, please be careful with this one because this one's a bit more risky than the other one, but we'll give it a go. So just be mindful if you've got any problems, please don't fall off your chairs, bang your head, be careful of your environment. But if you imagine that you were putting a small object on the floor, pen or piece of paper, and we were picking it up. Now, I can do that as quite a simple task for me. I don't have any damage to my body systems, it's quite a simple task. But even for me, if I was to put that pen on the floor, and lift my feet up off the floor so they're unsupported, I don't think I'm going to even risk to bend down to get that object. So that stability through the feet. The feet, I don't know if you'd agree, Les and Alex, but the feet are often forgotten about. And it actually, when it comes to stability, they're a key body segment. We've got 19% of our body weight going through our feet in sitting. And if we take those, they affect then on the instability of the pelvis. And just a simple task, coming outside our base of support to be able to reach and interact with the environment, to pick up objects, and we simply lose that function. And I don't have any damage to my body system. So to work with clients who lack that stability, the effect that can have on them. Now, whilst we're covering function, it's also worth mentioning a little about mobility and falls. So generalized weakness from immobility or even deconditioning can increase the risk of falls, obviously. And reduced postural control and this pelvic instability can result in individuals sliding out of the chair. So you might see the sacral sitting, sliding down the chair, or even increasing the risk of sliding out of the chair. Not only is obviously that a safety concern, but in terms of pressure care as well, maybe the shear and even the friction by sliding down the chair, increasing the risk of pressure ulcers. So even though we are focusing on seated posture, the success of good sitting posture will only be as good as the initial positioning within the chair. So that's why it's key to think about transfers into and out of the chair as well. And once the individual is in the chair, we have to keep them safe. So when we're thinking about that holistic approach, our clinical interventions are not just promoting the physical outcomes, but also their health and well-being as well. Because staying active can not only improve health, but also cognition, confidence, and mood too. And we'll probably cover that a bit later when we go into actually the case study with the transfers and the particular gentleman in question and the difficulties that we had with transfers in and out of the chair. In terms of falls prevention, just a quick note, the physical risk factors for falls are clear when we're looking at somebody's posture, but remember bringing it back to that holistic approach. What about the environmental hazards, polypharmacy or visual impairments? Can we have an impact on these to reduce the risk too? Moving on to interaction and engagement, these are essential when addressing an individual's psychosocial factors. So loneliness and social isolation has been found to be twice as harmful as obesity to physical and mental health, which is staggering really. An inability to sit out comfortably can result in our clients becoming confined to their bed in their four walls with limited interaction and engagement. But by achieving a stable posture, we can encourage participation in social activities. And of course, head control is essential for our clients to be able to orientate themselves, socialise, and then develop or maintain their communication skills. And this moves us nicely on to cognition. So when we think about cognitive function, especially if we've got people with us today who are working with individuals with dementia or those with learning disabilities, the introduction of seated systems at the appropriate time has been shown to facilitate psychosocial and cognitive development. Especially in learning disabilities, the benefits of postural interventions have included enhanced communication skills and cognitive function, which, as we know, are all precursors to improved learning and participation. Another major goal in postural management is to enhance the autonomic nervous system function. An inability to sit upright can result in decline in overall health, which might be shown then by altered physiological function. So our clients might be presenting with an increased risk of aspiration and infection, or even an increased risk of related hospital admissions. So just visually to think about this, this is an X-ray, and you can see there quite obvious scoliosis and a rotation of the spine. Trunk asymmetry, as you can probably visually see, will impair swallowability because you can see the head position there, digestion with the compression of all the internal organs, and even cardiac efficiency and endurance. And we'll go into a bit of detail of this when we talk about Ashwin later. The pelvic stability, trunk alignment, foot support, so all those body segments are vital for health and physiological function. And then moving on to posture and pressure. These obviously go hand in hand. We need to address an individual's pressure care needs, which will not only relate to improved health, but also bringing it back to comfort and the ability for them to be able to sit out for interaction too. Posture and pressure are inextricably linked, and body posture and the way we position it will have a direct influence on the pressure going through specific body sites. And you just see in the image, is probably not very clear there, but the different areas or high risk areas that we might come across in seating. I do realise this is a lot of information to get through in kind of 45 minutes, so we are happy to share the presentations, and we've obviously got question and answers a bit later on, but you can all contact us any time to ask any specific client questions, that's fine. But essentially with pressure injuries, high interface pressures cause the skin and then the underlying tissues become compressed. That means the blood can't circulate, so the cells don't get the vital oxygen and nutrients that it needs. The body can only withstand these high interface pressures for very short periods of time. And when the loading of the tissues is unequal and or the pressure isn't relieved regularly, then that's when pressure ulcers or pressure injuries can occur. There are a number of contributing or confounding factors, such as pressure, shear, forces, friction and moisture that are also associated with pressure ulcers. But when these pressure injuries occur, they can have a profound impact on our clients, especially their well-being, due to them being painful and debilitating. And actually, for those of you who might be working with older persons, pressure injuries are associated with a 5-fold increase in mortality. So it's really key that we address pressure management and pressure care needs to reduce these risks before they become an issue, because it's known that most pressure injuries are preventable. So appropriate management, or as we mentioned, better still prevention, will ultimately improve an individual's quality of life, especially our clients who are most vulnerable. And a key intervention that has been identified for prevention is pressure redistribution through regular positioning. Now, this repositioning throughout the day and night is critical for those deemed at risk of developing a pressure injury. So it's all about highlighting and identifying those at risk before this becomes an issue. And during the postural assessment, this is when it will become clear. I don't know if within, because we've got different services, health and social and NHS trusts, and all across the country joining us. I'm not sure who would be responsible for things like doing a baseline Waterlow score and things like that, but that might be something to discuss with the team. So the opportunity to sit out can offer this much needed regular change of position to encourage this blood flow and redistribute pressure. Specialist seating systems aim to reduce the risk of pressure ulcers, as we looked at earlier, by redistributing the weight evenly throughout the chair, but also different functions like tilting space, which we can discuss a bit later, will help to redistribute pressure as well and take the body weight through different parts. We wanted to touch on aesthetics here, and again in the case study this would become clear, as it's maybe not something that's really thought about as a significant impact on special seating provision, but it actually can have a massive impact on compliance. So it's important to consider the choice of material, especially if you're working with individuals with cognitive impairments, maybe those with dementia or autism, for example. Now, familiarity with learning disabilities and autism, familiarity with a particular colour or pattern can be vital and can be significant for them. And then finally, but most importantly, we keep bringing it back to this, it's about improving an individual's quality of life. And if we don't protect the person's body shape holistically, then it can result in many secondary complications and even sadly early death. This is how serious it can be. Okay, so that's enough of me talking for now. So we'll move on to the case. I do appreciate there's a lot of information, so at any point just just contact us, even if there's any client-specific questions. But let's move on to Ashwin's story. 71-year-old gentleman diagnosed with Alzheimer's disease in the early stages, care home resident, semi-ambulant. Care staff are noticing that he's becoming increasingly agitated when sat out. When he is sat out, he's seeming to lean to one side and slide down the chair, and is falling asleep quickly. in just the standard armchair that was available at the home. Carers are also noticing new areas of redness over the sacrum and heels, and they needed maximum effort to enable transferring. Thinking about Ashwin's postural challenges then, at the top we've got discomfort, fatigue, generalised weakness due to this reduced core strength, pelvic instability, so he's adopting this posterior pelvic tilt or sacral sitting and sliding down the chair, reduced mobility, which is evident by the need for maximum support from carers, which is then increasing his risk of falls, and an impaired transferability. He's at increased risk of pressure ulcers, so they were already noticing red areas, which it became clear that was due to the positioning in sacral sitting, and actually, honestly, we'll go into this in a bit more detail, but what we found with the chair that they were using, that it wasn't set up for Ashwin, and actually it was an incorrect seat depth, which was causing him to go into that sacral sitting, and he was sitting for too long as well in this abnormal sitting position. So the current chair was unsuitable, lack of postural support, lack of pressure care, and there was no opportunity to rest either. Okay, so I think what we'll do now is get the presentation down so you can see us again.
Right, what I thought I would do is I'll run through the process that we use to assess Ashwin. That's really from the initial telephone call from the nursing home where we were able to gather the information about Ashwin. We also took on some information about size, hip width, weight, so that when we visit, we can make sure we've got the appropriate seating with us. I'm not going to run through each product in depth, but I'll just run through very quickly, give you an overview of each product that, based on my experience, is the type of product we've used with clients with Ashwin's requirements. So the first chair we considered was this chair. It's called the Hydrocare chair. Very simple portering chair. Just didn't offer enough postural support for Ashwin. We've got seat depth adjustment on the chair. We could tailor the seat width and seat to floor height, but for whatever reason, it just didn't work. The chair had the built-in pressure care. All the chairs have built-in pressure care, but this chair was just that little bit under spec, if you like, in terms of what we required. It didn't really answer the fatigue situation with Ashwin's condition. I'll come back to this in a little bit more detail if need be, but just to say, if you need more information on any of the products you'll see with us this morning, have a little look at the website. That'll give you a full understanding of how the product works and what the various client groups are for the different chairs.
I think when we first spoke about, when Ashwin was first referred and we done the information gathering, the presentation that we had in our mind was a lot more complex. Yeah. And we went originally to try, I know you take different chairs along with you anyway, yeah, but we thought that the Hydroflex was going to be the chair because of this presentation. But what we found with the Hydroflex is that
I'll quickly run through that.
So the Hydroflex comes with a back angle recline. We thought because of its complex presentation and what we thought was the high risk pressure care needs, we thought we'd go with the Hydroflex, but actually Ashwin didn't need back angle recline. It's not something that was a requirement for him, and we didn't want to overcomplicate his prescription, and we wanted to make sure that the care plan that was in place was easy and simple for care staff to follow as well. So that's why we didn't go as complex as the Hydroflex.
That's right. We just found the Flex was overly complicated, and part of our assessment process, not just for Ashwin but for all our clients, is to make sure that wherever possible we choose the simplest solution, but we need to future-proof things as well. So if we don't think we need back angle recline, it can cause us more issues long run. So we discounted the Hydroflex. The other thing that kind of led us towards the Hydroflex initially was that issue that Ashwin and his carers were having with transfers. Now what the Flex does quite neatly is it's a slight negative tilt. The chair tilts forward slightly, so it would bring Ashwin's feet flat onto the floor for those transfers.
but because care staff were noticing, he was semi-ambulant, he was having these good and bad days, but actually the good days are now few and far between. They were actually going to start offering more support and maybe even trialling steady standing and things. So something like the forward tilt wasn't necessarily going to be needed in terms of future proofing for Ashwin, because he was deteriorating.
And he was deteriorating quite quickly as well. Staff had noticed a marked change over a number of months. So that leads us to the chair within our range. In essence, what we've looked at so far is something with mild postural support, more complex. And it brought us to the Hydra Tilt, which is more of a moderate pressure care, postural and pressure care product. The chair is some of the features that really work for Ashwin. We can adjust the seat width and the seat depth. Okay, so that provided Ashwin with really good pelvic stability. That ticked one of our boxes. Just so happened that Ashwin was approximately my height. So for transfers, when the chair was tilted forward, feet were flat on the floor. As Rebecca was saying, it's really critical that we get good foot support for clients in our seating because of the weight distribution. And to be honest, it's that much more comfortable as well. If you sit with your feet supported and unsupported, it's just a better way, more comfortable way to sit in the chair.
So when we covered the theory just now, we kind of worked through the different holistic approaches. Now for Ashwin, Les mentioned comfort there. What we ended up doing was trialing a range of different back supports. Obviously we wanted to get the trunk in midline and as upright as possible for Ashwin for obviously the clinical reasons, but for comfort for Ashwin, it was really a compromise, wasn't it? So we trialed the waterfall first, thinking that would offer maximum comfort. So this is the waterfall back, but actually didn't offer him the trunk support that we needed to stay in midline and to stop that lean. Yeah,
I mean, what we find is that a waterfall back it's a lovely product or accessory to assess with because it's quite an instant thing. You sink back into the chair and you feel really, really comfortable. But as we found out, Ashwin spends a lot of time asleep. The waterfall back didn't provide enough lateral support, so he was just drifting off. So there are things we can do with the waterfall back to shape it a little bit more. We can take some of the padding out.
So this is why originally as well we went for the waterfall, because Ashwin, because he was going into that posterior tilt, he did have a slight increased kyphotic posture as well in the thoracic region. So we thought that we could remove some wadding, but actually when not only did it not offer enough support, but actually we could correct his pelvic position, and which then improved his thoracic kyphosis anyway, so it wasn't needed for that reason. So we did end up then going for a contoured back instead. And
our colourful Hydra Tilt here is a great example as well of the importance of colour and fabric, because family were quite involved with Ashwin's chair purchase and assessment. And it was noticed that he had a certain affinity with, what was the colour? I think it was a green fabric. And that just aesthetic little twist on the chair specification was a key thing. Ashwin had this association of sitting at home in his green chair, and it was just that little thing that made that little bit of a difference. Yeah. But
obviously not this colour chair.
Not this colour, no. But so the waterfall back didn't really work. So
we didn't think the laterals would work either, because for Ashwin it was really about comfort in the chair, and we just didn't think that the laterals. Plus he wasn't that complex. We could correct his posture. We didn't need to accommodate any fixed spinal positions. We could actually correct with just a contoured back.
That's right. The contoured back is that example of compromise, where we compromise with posture and comfort. In terms of posture, perhaps ideally the adjustable laterals, which were really precise and accurate and held Ashwin in that midline position, were the best option, but he just wasn't comfortable. He didn't want to sit in the chair. He became agitated. He just didn't want to know. So the option was the contoured back, and I don't know if you can quite see the shaping of this back. It's a deep concave shape, which just prompts the person in the chair to sit in that midline position. It's prompting as opposed to kind of enforcing that posture. And that comfort, that nod towards comfort made the big difference for Ashwin. It really, really worked well. To add to that, we tried a range of different headrests. We've got flat headrests, soft headrests, foam headrests. The one which we found worked best for Ashwin, and I'll be the model, was the soft profile headrest. You can either use it just tucked down behind the shoulders, but Ashwin was falling asleep. And as he relaxed back into the headrest, you'll see the headrest envelops the head and just prompts me to sit in that midline position. So rather than Ashwin, I can't reach. Rather than Ashwin just falling asleep in this kind of position, we just use the headrest to prompt that midline.
Whilst we're talking about Ashwin fatigue management, another key thing was holistically, we mentioned energy management was the tilt and space function on the hydro tilt, because it really helped to give him a position to be able to rest in safely and recuperate, so then he could come back upright for activities he wanted to engage in. Yeah,
and that tilt in space, that constant angle between at the hip, between the back and the seat, it's ideal once we've got that pelvic stability. It's a posture neutral movement. Yeah. It doesn't affect his posture adversely. And that's why we edged away from back. We said we didn't need back angle recline because we could correct that pelvic position. Yeah. We could get good pelvic stability, and we didn't want to run the risk of back angle recline then impacting on that stability. And in terms of the assessment, obviously it's focused on Ashwin, but I think we also need to consider the environment, the care environment. And again, coming back to a chair like the Hydroflex, and perhaps a more complex chair within the range called the SmartSeat Pro, we do sometimes have concerns, if you like, on how well the carers can use the chair. So coming back to this, keep it simple, the HydroTilt meets that brief. Yeah. The only consideration for the carer is to make sure that the transfer in is sound and good. And it's just the lever on the rear of the chair, just to tilt the chair, you just release the lever wherever is most appropriate for Ashwin. While you've got the chair that way, I just wanted to show about seat depth, another key thing for Ashwin. Yeah. The chair that he was using in the home didn't have adjustability, so as we mentioned, it wasn't the correct seat depth for him, which was then forcing him down into that posterior pelvic tilt. So to be able to adjust the seat depth and prescribe it to Ashwin not only helps pelvic stability, but then function as well, because suddenly his arms were free, but rather than being digged into the corner of the back of the chair because he wasn't feeling stable, they then relaxed and were free to engage in functional movement. Now we've got seat depth adjustment on all the Careflex chairs. It's a critical feature for specialist seating, and we adjust it in a similar way on all the chairs. So there's a little lever on the left-hand side, which is a spring-loaded lock. Little knob on the other side. If I take the lock off by pressing it down, I can bring the seat base towards me to decrease the seat depth. The lock clicks back into place, or if I just take the lock off and push away, I can increase the seat depth. It's a very, very simple feature. While I've got the chair tilted or turned towards you, I'm sure that many of you are accessing equipment loan stores, Mediquip, Millbrook, NRS. You're having to reissue product. If it's a Careflex product, it's a Class 1 medical device, it'll have a unique serial number. Make a note of that number. If you're looking to reissue the chair with another client, let us know what that specification, that serial number is, and we can give you the exact specification of the chair, so we can advise on how appropriate that chair is going to be to meet your client's needs. That's a little hot tip for you there. Mm-hmm. And that's a key thing with Ashwin while we're talking about the pelvic stability and the function, was the contoured seat cushion, because he had good range of movement at the hips. We didn't need back arm recline, as we mentioned, but we still wanted to, of course we've got tilt in space, but we didn't want him in a tilted position for activities. We still wanted him upright. So something like a contoured seat cushion just helped to keep his pelvis at the back of the chair. So typically another feature another postural need that I'm aware of quite often when I'm visiting people like Ashwin is that potential for contractures, leg contractures. So on the hydro tilt, you need the ability to use a negative angle to accommodate that contracture. But what I find works quite well to help break that angle, that contracture angle down, is to use the contoured seat as well. Yeah, our seat cushions are easily replaceable, and we can take that out, they're held in place with Velcro. So we just could, if we needed. We didn't need to with Ashwin, to be honest. It worked quite well as the flat cushion, but it just gives you that option to work with those clients who are a little bit more complex in terms of lower leg postural requirements.
One thing we did think about was pelvic belt as well, a 4-point pelvic belt. I don't think that was something Ashwin needed at the time, but something we thought we might need to address as this condition progressed, but just to quickly run through.
Again, on the assessment, Ashwin didn't need these, but it's just reassuring to know that we can future-proof the product as well. So all the fixing points we need to use something like a 4-point pelvic strap are on the chair already.
And of course, we'd always risk assess to make sure I'm thinking about their capacity as well and consent issues and things like that.
That's right. So things I would take along with me to an assessment for Ashwin would have been a 4-point pelvic strap, possibly a groin harness as well, and a tray. Other things we considered for Ashwin, it didn't really merit a tray, but sometimes for function and for posture to open up the shoulder girdle, a tray is quite helpful.
I think the only activity that was important was the TV, wasn't it?
Yeah.
For him.
So as long as we lined up the.
That's a good point, actually. When we thinking holistically about the environment, I know we mentioned that, but there was an issue with the rotation, wasn't there? The care staff were noticing this constant rotation, and then we realised then that the position in the room wasn't actually in front of the TV.
Yeah, I mean, so in a sense, if I'm looking at you as the TV, Ashwin's chair was positioned at an angle. So for Ashwin to look at the TV, he naturally sat in this position.
Yeah.
So
it's a really key part of thinking holistically about how the chair's used, but actually that wasn't a body structure issue. That was totally the environment causing that as well.
Exactly.
So yeah.
And those are things that, as part of the service that we provide, obviously we'd come along and carry out the assessment, but the chair setup is critical on the care plan.
Yeah.
This type of product, the devil's in the detail. It's the fine little nuances of the product that make a big, big difference to the person sitting in the chair. So colleagues like Alex and myself would set the chair up for Ashwin, but I spent at this occasion, I spent some time with carers to explain how the chair worked and to explain the relevance of using the foot plate, tilt in space, seat depth and seat width. It's really key part of that. Not just the assessment, but the provision process.
Yeah. While you're talking about the foot plate, obviously one of the challenges for Ashwin was him being semi-ambulant. We still wanted to promote that independence, but also make sure it was safe as well. So you showed about the negative angle and the flip up as well, so they could actually get good foot placement onto the ground, and then the handles as well, the hard handles to be able to propel and push himself.
So very simply, that's all staff were doing. Just flipping the foot plate up. We did try just removing the foot plate if need be, but we didn't need that. Ashwin was quite adept at transferring from the chair at the seat height we have for this chair.
And actually his transfer has improved quite a bit because the seat height was so much better than the current chair that he was using. The other one was too low for him to be able to actually get a good propel upwards.
So that's Ashwin, I believe.
Yeah, I think holistically we looked at comfort, engagement, it was about the environment, the aesthetics for him and how all that actually came into play. And if we hadn't considered all those extra things, like those details, I don't think we would have got him sat in,
as I said,
that chair.
The devil's in the detail. The more information you can provide us with up front, the greater our chance of a really positive intervention. Even if it is, as it was with Ashwin, it was a good day, we were able to try 3 different chairs. Maybe that the window of opportunity in terms of Ashwin's agitation may only have allowed for 1. So the more we know about Ashwin, and clients like Ashwin, the higher the chance of a successful provision of a specialist chair.
Yeah, it's going back, I mean, we love that word holistic, going back to daily life for them and how the chair is going to fit in and how we're going to boost that engagement with the piece of equipment.
That's right. I mean, even just go back to the colour and this choice and this association with clients like Ashwin. I had a client once, we supplied the Hydrocare chair, and the brief on that day was that semi-ambulant, just cannot seem to get comfortable in any chair. We're not really sure what's happening. Gets agitated because he's wandering all day, just cannot sit in a chair. So we just rolled in the Hydrocare. I was expecting to be there for the best part of the afternoon. Our client came along, sat in the chair, not a problem. Just watched TV, fell asleep, ideal. Great result. On leaving the home, just popped in to see the manager and just explained the situation and what we'd achieved with the resident. Great. What colour chair would you like? We've just painted the lounge. We'll have a nice magnolia, cadet magnolia fabric. Fantastic. Chair was delivered 2 or 3 weeks later. Telephone call. Can you come and have a look at the chair? There's something wrong with it. Cut a long story short, it was the wrong colour. Family had come in and said, Dad's got an association, again, not with green. I think it was a red at the time. A red chair is all he needs. It didn't even need to be specialist chair. They'd found another chair within the home that was a red chair. He'd sit in that chair quite happily. So it's a really key consideration.
I think we've had a case as well with a paediatric with autism, and it was a particular pattern, wasn't it?
Yeah.
And they had bespoke covers made. Yeah.
That's right. I mean, we've. I've got to be careful that I don't go into sales mode here, but I'll just show you some colours. We have a wide range of colours, and we can quite often match whatever the need is. But if there's a particular association or a particular need for a certain fabric or a type of fabric, we can normally source that as well. Again, if we know that up front, we can take samples to show people as well.
Okay, I appreciate the time. So I think I just wanted to get the final bit of the theory up, just to quickly cover the rest of the holistic approach, so the support network, and just some interesting figures which we have found. We've had quite a few people with funding requests, and what we've found is actually giving cost saving figures sometimes helps to get that funding in place. So the support network then, so I mean in Ashwin's case, it was all about improving transfers and the moving and handling process to try and ease the carer responsibility and reduce the client's dependency on them. It was about manoeuvrability as well, so he was using the chair between the lounge and the bedroom to be able to transport the chair as well around. And Les picked up on it as well. One of the key things with the support network is that consideration of their knowledge and skills, especially in situations where there's a high staff turnover and training needs. So we have gone in and done specific training for
just another
clients.
Key thing for Ashwin, well, not just Ashwin, but clients like Ashwin, especially in a care home environment, is how is the chair to be used? Because we can cut down on manual handling. So the idea for Ashwin was that carers transferred in his bedroom into the Careflex chair, and were able to push the chair down the corridor into the lift, down on the ground floor into the lounge, and they were able to cut out the number of manual handling procedures. So that was a key requirement for Ashwin, but for Ashwin's carers.
Yeah. And then cost effectiveness. So as healthcare professionals, we don't necessarily think about the cost effectiveness side of things because we're obviously focusing on the client and improving quality of life for them. But actually, I guess we've all got a role to play. We've all got responsibility in being careful with how funds are spent to make sure that we continue with long-term high quality care, to make sure that funding pot is always there. And I think in different areas we've come across lots of different challenges. In some areas it seems quite easy to get specialists in others it's really difficult. So if we do have specific things that we can help with that, if you're getting a Careflex chair, then we can help with that funding request. But I just wanted to run through quickly just some interesting figures. I mean, this is just about the prevalence. So there's been different audits done. So there was one in NHS England that was done recently, and what they found in different trusts, so it ranged from the prevalence of pressure ulcers was between 3.9 up to a staggering 27.7%. A similar audit was done in Welsh hospitals with Professor Clark back in 2017, and it was estimated at an average of 8.9 there. I think the average in England was just slightly higher, but it came in around the same mark. What's difficult is finding actually what the prevalence is in care home settings. It's not really a figure that's been pinpointed. It's a difficult thing to be able to try and audit. But what they're suggesting is that 2 to 28% of residents could be affected. So again, that's quite in line with what we might be seeing in hospital settings. And then the community is obviously even harder to know who might be affected. But if we consider in the amount of people and the fact that pressure injuries are mostly preventable, and the fact that it's still costing the NHS 3.8 million every day to treat pressure damage, and that the annual combined wound care costs is around 4.5 to 5.1 billion. Treatment costs are estimated between £1,000 for grade 1. So that's where the skin is still intact, through to a grade 4 where we've actually got full thickness tissue loss, even down to the bone, could be up to £14,000. So if you're thinking about the incidence in care home, and potentially 20% of care home residents could potentially have a higher grade pressure injury, and the amount then that's being spent on that's pretty clear that savings can be made if we reduce the number of people who develop pressure ulcers. And specialist seating and any form of postural management has to be a key part of that. It's not just about plonking a cushion on top of something. That's not going to solve the issue. We need to look at it holistically and see how posture and pressure are linked. And we are seeing improvement in that, definitely. I think Les and I went to a women's conference and presented there, and there definitely seems to be a bit of a shift. So hopefully we can keep pressing that. With falls, so with specialist seating and any postural care, we're obviously hoping to reduce the risk of falls and ensure safety too. Now, hip fractures alone account for 1.8 million hospital bed days in the UK, and actually cost 1.1 billion in hospital costs every year. And that excludes the cost of social care as well that might be needed following that, because people following the hip fracture may end up needing extra care, especially in the older person. So when you're thinking about hospital admissions and those hospital bed days, the average cost of a day case, I mean, these are just staggering figures. I won't spend too long on these, but it's just about being clear in our funding requests, actually, because I know medical equipment, they do come with a price tag. They are specialist equipment, but it's just about the way that we portray that. They're not comfy chairs. It's a prescriptive medical piece of equipment, just as important as somebody's medication prescription. But we've helped people to provide these costs and figures just to show how it's cost saving, and this would obviously form part of a much wider funding request, which we can help with. So who is at risk? I just wanted to put this in here just as a bit of a tip, really, because when we're thinking about identifying those who are at risk, because the key here is to get postural equipment in a timely manner before the secondary complications become irreversible. So things like contractures, they're really difficult to work with once they get to a point that that's a fixed posture. So if we can identify those at risk and put postural equipment in before those secondary complications, then that will be the key. And it's about thinking holistically as well about those people who are at risk, because we're obviously going to identify those who lack the physical ability to change position, but it's also thinking about those who lack the cognitive awareness to know that they need to change position, but also those who lack the communication skills to convey that they need to change position. And then the care plan for these type of complex patients or clients is really key, so that they're either prompted to change position or they have full assistance to achieve a regular change of position. I'm aware that we need to do a question and answer session as well. So let's just summarise what we mean by holistic postural care and achieving a good sit-in posture. So we're protecting the body shape, we're improving stability and functional movement, improving an individual's well-being through interaction and engagement, improving their health and physiological function, thinking about the support network as well, reducing the carer load and dependency, improve pressure redistribution, because we really need to press that posture and pressure are inextricably linked. And ultimately, we're improving quality of life for the client and the support network, but also achieving our clinical objectives too. And remember, we cannot achieve those clinical objectives without a holistic approach to specialist seating and postural care. Okay, I think we'll get rid of the presentation. I'm not sure if there's any questions.
We'll take some questions.
I think people can unmute their mics, can't they?
Yeah, if you want to unmute your mics, or if you want to put your hand up.
Yeah, I'll pop back up on the camera, yeah. Yeah,
we'll deal with questions. Microsoft Teams is a great thing, but they seem to have launched a new version of this overnight, which throws a little bit of a spanner in the works. Anybody with any questions? If you want to unmute your mic.
I think we've got recommendations for best back for kyphosis. Thank you. I think we touched on that with Ashwin, didn't we? I guess the simplest and the least invasive option would be something like the waterfall back, which you can see on the hydro tilt here. And as we mentioned, what the great thing about a kyphosis, obviously we're trying to target that thoracic region. And what we can find is that the apex of that curve might become red or is at risk of pressure injuries. And that will be falling straight into that middle section. So you can actually remove, bear in mind there's a difference between a correctable kyphosis and one that's fixed. If it's correctable, then great, pelvic stability and trunk alignment can sometimes improve that without the need for actually postural support. But if it's a fixed kyphosis, the simplest one would be to remove the wadding.
There's a couple of tricks, if you like, from our kit bag, and one of those would be waterfall back, comfortable. Sometimes you can achieve a lot where the contoured back with a soft profile headrest and opening up the back and putting some more padding into the back of a flatter back. We have a service called Tailored Solutions or custom-made devices. What I'd look to do potentially, I can replicate this for you now, is rather than having the different cushions run horizontally, you take the bottom two out. And turn it into what I call a tea bag. So you get the benefit of the soft surface to absorb the kyphosis, and the vertical running cushions to give you that midline support and prompt. There's other chairs within the range. I'm really thinking of clients like Ashwin at the moment. We have a chair called the Smart Seat Pro, again, which may well be worth looking at if your client has kyphosis.
Yeah, there's something like an articulating headrest as well on the Hydroflex. So if we are working with the fixed, because kyphotic postures are notoriously difficult to work with because we can't get the client to the chair. So sometimes we might need to bring the chair to the client, and that articulating headrest might just give that support that's needed. I guess the key thing with a kyphosis is not just, again, thinking holistically as well and thinking about the whole body, is thinking about the associated problems that come with a kyphosis and making sure that we are targeting the pressure care that's needed. There's probably a posterior pelvic tilt or a sacral sitting that comes with it. And sometimes people need an anterior support as well. So something like the chest harness or the tray can sometimes give that prop anteriorly as well to try and encourage that shoulder girdle to open up.
Fantastic. So we do have a couple more questions.
Okay.
So what are the weight limits for the chairs? Are there any bariatric options?
We have a bariatric option for our Hydro Tilt chair, which would take us up to 35 stone weight limit. The Tilt, Flex and Care are a 25 stone weight limit.
All right. So next question. We have a few attendees involved in paediatric today. Can these all be applied for these users?
Yes. Well, other than the Hydro Care, we do paediatric sizes for the Flex, Tilt and another chair called the Smart Seat Pro. And they all have the exact same feature set as we've run through very quickly this afternoon. Well, it started this morning, it's this afternoon now.
So followed up by, I have a client who had a stroke many years ago, which has leans to left-sided high tone. Which has led to left-sided high tone. She sits in a wheelchair all day and leans to the left. She now has started drawling when seated. Is this preventable with a chair?
Again, well, first of all, what type of wheelchair is it?
Yeah.
I mean, sometimes if it's a tilt and space wheelchair, that can help, possibly open up the back angle slightly. Regrettably, quite often in Ashwin's situation, I see an awful lot of residents sitting in transit wheelchairs, which are bolt upright. We need to consider some form of tilt and space for that client to make it a slightly more energy efficient way to
I guess
sit.
the issue with this one is though I think they've said drooling, is that what they said is happening? So we've got to be mindful with things like tilt and space as well, because if somebody is drooling or pooling saliva, we need to make sure that the swallow doesn't pose them at risk of aspiration or something. But certainly seating, it's about thinking about the night time as well. If they are leaning, are they becoming fixed at night time? Are they maybe sleeping in left side lying or something, or rotating during they sleep? So it's about looking at nighttime positioning as well. But certainly the chair and the wheelchair and all kinds of seating during the day should be looking at either correcting if possible. But it sounds like that if this is a tonal problem, that we might just need to accommodate some of those postures and just give them that feedback on the left to prop them as much as possible.
Fantastic. So there was a further comment based on that same question. So its wheelchair clinic did not provide special chair and has said that they won't. It's just a standard chair.
Yeah.
Specialist wheelchair, okay.
I know that they tend to look at it different parts of the country as a mobility aid. So if that, I'm not 100% sure on the right terminology here, so bear with me. So I think they'd only look at providing the specialist chair if that client or resident had the ability to leave the home. I don't think they'd use it as a specialist chair within the home environment.
Yeah, I think it depends on social needs and how it's different in Wales, where we work is very different. I think in England, I don't know if it's still the same now, whether they provide vouchers. I know they used to do that, vouchers towards if somebody needed to go and purchase their own specialist chair, if that's something, or a secondary chair or a battery, that kind of thing.
Yeah.
There were vouchers, but I don't know whether that's still the same in England. I guess the key thing here might be it might just be a need for a multidisciplinary letter or something to wheelchair, given the reasoning and the clinical justifications and the backup for those claims to why maybe if you think a more specialist chair would be needed.
In a sense, it's a nice way to kind of round up. It is a totally holistic requirement, isn't it? It's looking at that person's postural needs plus their well-being to get out, to see the garden, to get down the street, or to sit comfortably at home.
To see whether you can come and I guess fight to get into that decision and appeal it, maybe to see whether what else. But obviously we don't know different trusts what the provision is, but it might be worth just going back with the clinical justification of why you think, especially if they've had this stroke, is going to be a long term now. That posture isn't necessarily going to be getting better. If anything, we need to try and reduce the risk of that getting worse. Because especially when you mentioned the drooling and things now, then that could pose a problem. Yeah.
Is that everybody?
So yeah.
So I think we've come to the end of our session this morning.
Appreciate a lot of information, so do get in touch if you've got anything specific.
Yeah, if you need to get in touch with us, I think it's info@, is it? That's correct. It's info@careflex.co.uk. If you need to get in touch with myself, I'm les.jones@careflex.co.uk. Rebecca is
Rebecca.Dunstall at careflex.co.uk.
And Alex is Alex Hayes.
Alex.Hayes, yes, absolutely. You'll be able to find information on each team member on our website as well, under the Meet the Team, with direct contact numbers, direct email addresses there as well. So I think I think it just looks like it might be feedback now. So
okay, well,
let's just go through.
Brilliant, thank you for joining us.
Thank you. Enjoy the rest of the day. The good news from Devon is that it stopped raining and we're sending it your way. So thank you very much.